Hello, hi guys, welcome to my YouTube channel. My name is Dorothy and I'm a clinical officer, and I'm very passionate about making reproductive health easy and easy to understand. So I'll be introducing a series called Ask a Doctor, a reproductive health series where we're going to discuss all matters concerning reproductive health. So all your questions, we are going to answer them here, and then we're going to be talking about different topics in relation to reproductive health, from menstruation, contraceptives, infertility, and gynaecological issues. Or we're going to be talking about them here. So for today's question is: can someone ovulate during their menses? That is, can someone get pregnant when they have intercourse during period? So the answer is yes, and we're going to explain why. So before we do that, kindly subscribe so that you don't miss out on our next videos. So for us to understand how someone can ovulate during their period, let's briefly see about a menstrual cycle. So the normal menstrual cycle is about 28 days, but it can range from 21 to 35 days. Okay, and in a menstrual cycle, it has three main phases or three main stages. The first phase is between the first day you get your period and day 13. It is called follicular phase, or we can call it pre-ovulatory phase. The second one is the ovulation itself, that is normally day 14 for those who have a 28-day cycle. And then the third phase is the luteal phase, or we can call it post-ovulatory phase. It lasts from between day 15 to about day 28. Now, the first phase, the follicular phase, from day 1 to day 13, this is where the period happens from day 1 to day 7. Some see their periods for 3 days, that is from day 1 to day 3. Some will see their period for 4 or 5 days, some up to 7 days, sometimes even more. So there are those who have a 21-day cycle, which means they have a shorter cycle than the normal, the 28-day cycle people. Okay, now the third stage of the menstrual cycle, that is the post-ovulatory stage of the luteal phase, it lasts for 14 days. So whether you have 21-day cycle or 35-day cycle or 28-day cycle, the last phase of your period will last 14 days. So the first half phase of the period will now differ. For the ones who have 28 days, it will be about 14 days. For those who have 21-day cycle, it will be seven days. For those who have 24-day cycle, it will be 10 days. For those who have 35-day cycle, it will be about 21 days. Okay, so normally when you have sexually unprotected sexual intercourse, the sperm can survive up to 5 days in the female reproductive system. So for someone who has 21-day cycle, which means they ovulate on about day 7, if they are seeing their period for like 3 days and then they have sexual intercourse after their period, it is likely that they are going to get pregnant, because ovulation will occur and it will be about 3 days from the day of intercourse. If they have intercourse during their period, the chances are, as long as the sperm is going to survive for like 5 days before ovulation, the chances are they're going to get pregnant. So the answer is yes. A woman can get pregnant if they have intercourse during period, but only, number one, for those who have short menstrual cycle, that is about 21 days, and number two, for those who have a longer period length, like they see their period for 7 days and above. The period can coincide with ovulation, or the period they have intercourse can be close to ovulation. And if it's like between 5 days, there's a possibility that they're going to get pregnant. So it is very important as a lady that you track your menstrual cycle so that you can know how long your cycle is. You don't have to master it in your head. If you're a mathematics genius, well and good, but we have apps nowadays for that. You can download an app that is going to help you track your period so that you can know how long your menstrual cycle is. It will be very important because it is also going to help you to understand if you are having a normal menstrual cycle or you are having hormonal imbalances and hormonal issues, because you might be seeing very heavy period with very painful cramps and a very long period, and you think it's okay, but it might not be okay. So let's track your period so that you can know the length of your cycle. Number two, always use a contraceptives or protection or both. If you're not planning to get pregnant and you're having intercourse, unprotected intercourse around the ovulation period. Okay, so on the comments, drop your questions and tell us how long your cycle is. If you know, if you need help, just comment below. We're going to get back to you. Thank you for watching. If you like this video, share it, like and subscribe so that you don't miss the next